So you have to separate these out, inputs versus outputs. So we can't say like this thing causes that pain. It's that under these circumstances, with these additional stressors, if it is enough of a threat, then the nervous system will trigger the pain response.
Yeah.
So separating those out when we talk about back pain, because people go, what's causing back pain? Is it ligaments? Is it nerves? Is it discs? Is it muscles? Is it bone spurs? Is it God knows what? So that's the first thing to bear in mind. So what are the kind of threat factors? How do these things build over time? So we'll put this in the show notes. We talk about one of the primary contributing factors, I think, is when the hip flexors in the front of the body become short, tight, and facilitated. So they lose their ability to return to their normal resting length. And we do think that this starts a lot from really even early childhood when we're required to sit for prolonged periods of time. That prolonged sitting kind of causes fascial layers to start to stick, but it starts to develop neural habits as well. The brain thinks that that's the neutral position because we're in that position for so long. So it starts off as a loss of extensibility, we could say, in a lot of the different hip flexor muscles. And there's 5 or 6 of those, depending on which ones you include. Generally, we have a motor dominant side. So one side is going to get a little bit shorter, a little bit tighter than the other side. And so then this starts to, the muscle tension, I think, restricts the amount of motion in the hip joint. And as a result, then we start to develop sticking within that capsule, what we'd call capsular adhesion.
Mm-hmm.
Once the capsule gets stuck enough, when we try to move our leg, it pulls that side of the pelvis with it. So the whole innominate, or we'd oftentimes refer to it as the ilium because that's the bony landmarks, that side of the pelvis pulls forward. So if we look at this on our bony model, we would say that the hip gets stuck and it starts to pull that side of the pelvis with it. And we get this moving forward and down, what we call an anteriorization or anterior inferior rotation of the right ilium. When that happens, then it starts to drag the sacrum with it. And so we get these two different types of dysfunction, what we'd call sacral torsion.